Alright, so I was just watching a video a while ago, and there was this young lady who went to the Bustamante Children's Hospital, and she was just making a little, comment about her experience. It was more than comment, but let me just be clear here before anybody gets uncomfortable, because this video is not about bashing Jamaica or the healthcare workers, because me a nurse and I used to work in Jamaica, but it's just about speaking out and speaking the truth so we can actually try to see how we can make some change. Because I love my country, and not because I love a country that you love something, it doesn't mean that you have to stay silent, because there are so many patients in Jamaica who are suffering, not just because they have an illness, but because of the way they're being treated, and it's because of when they're going to seek help. So if you've ever gone into one of those hospitals or clinic in Jamaica and felt ignored, you felt embarrassed, or you felt as though you're being talked down to or treated like a burden, then this video is for you. And as I say, I've worked in Jamaica, so I'm a part of the class of persons that I'll definitely be addressing in this video, because after a while, when you work in a system where it is understaffed, underfunded, and a lot of things going on, definitely I'm gonna be a part of the people that definitely need to be addressed. And I've worked in multiple health systems across the country. Definitely me know what the experience is like when you have understaffed and people are, emotionally exhausted. So I'm Stacy, I'm a nurse, and today we're going to talk about the health system here in Jamaica and how patients are being treated and the disrespect many patients quietly endure. And why I want to talk about this is because yes, we're hearing it over and over, where it seems as though this is something that has become normalized, and we need to kind of fix the problem. So as you know, that Jamaica public health system, Jamaica health system is public and it's very accessible to everyone, and that's very important and we love it. But the reality on the ground is that it is so overcrowded, and the long wait time is there, the short staffing, limited resources, the burnout with the healthcare workers. It is so common, and you'll hear people talk about it when you go to the hospital. The waiting hours, sometimes days. People are on benches, on stretchers and corridors, and that is what she was talking about as well. And when the system is like stretched like that, you realize that patients, they pay for that emotionally, physically and mentally, and they complain, and there's so many things going on in the facility that people have to deal with. But we're going to talk about the part that nobody likes to say out aloud, because many patients, they report how they are talked to harshly. They are being dismissed when they complain about their pain. They're being shamed a lot of time. They're being yelled at instead of being educated. They're being ignored because others are considered to be worse off. You understand? Some patients are afraid to ask questions because they don't want to be labeled as difficult. Others are told, if you don't like the service here, if you don't like it here, just go private. But how many patients can really go private? Because they can't really afford. They cannot afford it. And we need to remember that healthcare is not just about, it's not about giving medication. It's about dignity. And that's just it. So we need to remember that. So when we go out there, try to keep that in the back of our mind. But one thing that is very dangerous that we are seeing is the disrespect. The disrespect that is becoming so normalized in our culture. Patients are being told that this is how it is. The nurses are tired. The doctors are busy. Yes, we understand that healthcare workers are tired. We understand that the system is broken. But tiredness should never justify humiliation. It should never justify humiliation. A patient should never feel like they're a burden. They should never feel like they don't matter. They should never feel like they should be grateful for the mistreatment that they're getting. At no point when they come to seek care, that should be the feeling that they're getting. And let me just be very clear here, and I don't want this conversation to seem like it is one-sided, because there's always two sides to it. Because me on the other side as a nurse, definitely we have feelings, and we have feelings too. Because many nurses and doctors in Jamaica, we're overworked, we're underpaid, emotionally drained, and we're doing the job for like 3 or 4 people. Some are working shifts with no breaks, limited resources, supplies, the constant pressure. Burnout, it changes how people show up. It changes behavior over time, but it does not excuse abuse. And 2 things are true about this with the situation. Healthcare workers, they deserve better working condition and pay, but at the same time, patients deserve to be respected and humane care. And when we treat patients in that kind of manner, what happens is that they delay seeking care. They stop trusting the system. the conditions tend to get worse and preventable deaths start happening. And so what we realize is that patient prefers to suffer at home than to go back into the hospitals where they are feeling so small and disrespected. And this is what should be alarming us. This is what should be alarming us. So we need to figure out how we can change this. And change does not, start with silence. We need to be accountable. We need better staffing. We need better pay, patient advocacy, communication training. And we need, management that listens. The patient, they deserve respect. The patient deserves explanation. They deserve dignity regardless of their income and their class in society. And we as healthcare workers, we need to remember that healthcare is not a favor we're doing, It's not a favor. It's a basic human right. And until we start treating patients like people and not problems, the system will continue to fail the very ones it is meant to protect. And we can see it as we speak right now, even today. Yes, that's what she was talking about in her video. You understand? So let's try to see if we can talk about it. Let's just try to see if we can educate and push together for something better. Because silence will never heal. We never see silence heal anybody yet. So let's just try to see if we can have honest conversations. Put your comment down in the box below and tell me what your experience is like. Honestly, let's try to keep it, respectful. Let's just talk about your experience in the facilities there. Try to be respectful so we can actually have open and honest conversation to see how we can move forward in building and making change in our facilities in Jamaica. Remember to go ahead and subscribe to my channel here at ThinkNursing. Most importantly, give the video a thumbs up, a like and a share, and just have a friend or two come on to my page and be a part of the family. Until then, I will see you in the next video. Bye.